the whole step. This was the whole step. Well, this was the girl in blue, Sherry and Gladys are there. This was the clerical step. This is probably, when I started in 1971, there were 5 nurses and Gladys and 1 person, period. So by this point, we've got Mary Ann, Joyce. Medicare and Medicaid only came in the 60s, so billing only began. So the people there are doing the billing. This was the whole step. Everyone here is a nurse. Gladys would have us Monday morning. This was a meet. Everybody had their schedule, and we would know what we were doing for the week. And the other thing is that, I don't know whether people know, but this area, it was called Workman's Circle, right? And that this was the place that the county, the original public health was down the hill, right, in the building. We'll see a little bit later. Anyway, this was nice. We went outside. That's the building. People had cars. People had county cars. This is the going off to work for the day. Bobby Stewart, the driver, was actually there. The Cecil Stewart, who was the supervisor, and Alan Freed is an amazing. He's died, but he was the head of this. He also was the medical director at the infirmary. We passed them with the person. They ran a physically handicapped children's program. That was the only program that really public health was doing at the time. But Alan Freed, you just can't say enough. One of the interesting things about public health is that we, in 1971, brought Planned Parenthood, this building down the street that we were in, had no room. We had Planned Parenthood. Dr. Freed was the physician for that. Had the exam table under the stairs, right? But we brought Planned Parenthood. And one of the things that I'll refer to all the way through is that public health, right, prevent, promote, protect, right? You're looking in public health for where the gaps are. And certainly back in the 70s, there was no, Planned Parenthood was nowhere. So we brought it in, got it started, and then they got their own office. And Dr. Freed was a physician for that. This, I hope can understand. So we would have to say, this is actually, right, what was used, right, John Mullen, figures on present spent and amounts left in each category as of August 31st, 1972. So spent 44,000, like left 37. So I think Freddie noticed that. But this is what was presented at like the Health Service Advisory Board, not by me, by Gladys, but this is the difference in finance today. We had like, this was our only high-tech piece of thing. It was a Xerox machine. It was a nightmare. We had, showing the body, equipment. But anyway, so this is, so on the left is Hilda Gladys. This is Bob Travis, right? So he was the social service commissioner. And as part of these grounds, the houses down there he lived in. Right? And then before this, and then he was the last commissioner to actually live there. People who came after him didn't live well there. And then Stella McGorian. So Stella and Gladys were the nurses, and we're talking about home care. They were doing home care 60, 70 years ago. They were actually out in the communities with hot packs for polio patients. There were, and because polio, right, Liberty Loomis being a thing, there were a lot of old polio patients. So anyway, they would go around. Laura Bitter was the head of cooperative extension. They were still on the 3rd floor in a bank on Main Street. Trying to look at the work that, So the state, so public health had 5 nurses and Gladys and this was the orthopedic clinic. the state would send down the physician to Dr. Carey would come here. There was a lot of, bowlings with kids and stuff. And what would happen was, so we would have this little baby, these are called Dennis Brown splints. I don't even know if anybody uses them anymore, but you would have the child and you have to show the mom how to do this, right? And how to keep this splint on the child, right? And depending on what we saw, we would also do a home visit off of it. Tuberculosis, that's me. And I know this is 50 years ago because I'm pregnant and my son's 50 today. Sullivan County had a lot of tuberculosis, right? Now why is that? Part of it because people went to the mountains, this is where they came. There was Liberty Loomis, right? Who had a specialty of tuberculosis. And the hotels, like the big hotels, right? They actually would send a bus down to the Bowery in New York City, pick up the guys, bring them up here to wash the dishes. And they had been exposed to tuberculosis. So I was running, the way you can see if someone has been exposed to TB is the skin test, or PPD, and knobbies and bars and all. Anyway, we bring them up here, and at this point, the treatment for tuberculosis was about 2 to 3 years, right? And then there was a drug, INH, that you took for a year. The other thing, this is one of the patients, and we would go out for home care, come to the clinic, and then we would make sure that they were taking their meds and they were good. And just having to teach people, again, these are meds they were on for a long time. What we didn't know in 1972 was that TB was one of the opportunistic infections of HIV, right? And this is where, it was showing up. So the other thing that was new at the time was a sexually transmitted DD clinic, right? And there was no. We started the DD clinic. Stella, I thought she was old at the time. She was probably 50, right? The other nurses thought they're a little bit older, and they're like having so the state came down and did some training, and they're having to say, like, have you had a blow job? And that is so anyway, and interesting that this is the first time that drug resistance really showed up. PPNG, right, penicillin producing Neisseria gonorrhea, was really the first sign of drug resistance coming into the thing. So anyway, we did this, and then the state had a work that followed up contact tracing. This is the early contact tracing. This is her immunizations, right? Who was getting ready for immunization? We did the immunizations at the schools, right? And like now, but much, much less. There was some vaccine. The schools, everybody had to be vaccinated for measles, mumps, rubella, polio, diphtheria, and pertussis. The DTP was where you got a lot of community concern about all kinds of things. Anyway. So good nutrition, good health. We started the WIC program. Sukasovsky was the person. We just ran out of room in the building. We brought a trailer up next to the thing. And we had the WIC program. It was amazing. A heavy maternal child health. We did a lot of maternal child health. We had a well child clinic, right? And again, that's all down there. It's, bringing them in, bringing them up. But we had a very large home visiting thing. The scale was actually carried by the nurse. In addition to these bags we're carrying, right? We carried the scale on there. show the mothers what they're doing. Showing that, so it's like a teen mom, right? So we're making sure that she knows what she's doing and having a thing. Later, back, I don't know when I was back in maybe like the early 90s, but I actually had a teen parenting program, and we had all the teens that had babies. The other thing is when you go and you see a baby and you see the mom, and this is the whole thing about home care. You see the environment that you live in. You really, when you're in a hospital or when you're in a clinic, you don't get that. When you go in that home, you've got a much better idea of what's going on. There were also, right, we had disabled kids. Now this is before the Center for Discovery. What there was up on the Wanda Avenue was the CP Center, right? And by Roland Smiley and stuff and Maritis. And it wasn't until Pat Dollar really came in that we had, somewhere to deal with these kids. But, there was no early intervention program, right? It was, the thing about the home cares are also very family oriented. So here's a family that little boy got a tracheostomy, right? So we're looking at him, showing him what to do. The mom's just had a baby, right? Trying to make sure the baby stays healthy, showing him what we're doing. Here he is. Very sweet family. There's another one, right? You can see the head lag on this baby again. This would immediately, be looked at, have somewhere to go. At this point, there were no services. Home care was it. The home visits were it. That was insulin, showing them how to, manage insulin. Young diabetics, right? A little nutrition counseling in the home. I just kept this one. My favorite is the kid in the background with his lip and his ribbon. Right? You want to make sure he had a ribbon. But this is a real, and again, this is 50 years ago, right? This stuff was like new. People weren't doing this, right? We were out there with activities and counseling. Look at the oxygen tank. What do they have? This big, right? So people had to learn to use oxygen. This lady, I actually got to visit her. Very interesting. She's like 94 years old. She had diabetes and a pacemaker, but again, the home care, you get to learn that she was actually a medium in New York City and did readings, like Monday through Friday, several times. And they're putting her pacemaker in, she's like talking to the doctor, and he's like freaking out, right? She's like used to that whole thing. But anyway, we kept her at home. This is another woman, broke her leg, lives alone, trying to make the food available to her, trying to see, what she can do. This is another family. The wife's had a stroke, right? She's got the, right-sided weakness. Some family there. She's just learning to walk. Yeah, also at this time, the state would send a physical therapist down here, and the nurse would go out with him, and they would set up the visit. The nurse would do the follow-up care and do the visit. This is the husband of that woman in that same house, right? And we kept them home. We kept them home, right? They did not, with a sufficient amount of help, we kept them home. This was, again, when I look at this, I'm like, where are the gloves? The gloves weren't really there yet. We didn't have anything effective, but this is it. And this is teaching the families to care for wounds like this. This is really what it is. Same thing, right? Big wounds, right? And again, lots of them trying to keep people at home. So one of the things about this is that we drew bloods. The public health nurses drew bloods. This person couldn't. We drew the bloods, and as a result of this later, I had put together some in-service training. There was the dialysis center was not here yet. People were getting CAPD, continuous peritoneal dialysis, at home with the public health nurses. We were flushing PICC lines. It was great. And at one point, all 6 nurses that worked at the ICU unit at the hospital came and joined public health because of the reputation that we had, because of the work that we were doing. So very, very proud of this. So this was a woman that had neurological issues. The state had come in and set up some PT for her to do at home. She was a young mom, kept her going. But then we finally got, after the CHHA certification, able to have speech therapy. So this is Vivian left out with speech therapy which was, she's pregnant with Samantha, so if anybody knows Samantha, this is mom. And just, showing my people. Jim Spinks was a physical therapist that had worked at the hospital and then opened his own practice and then did all home care for us. Because I'm here and I'm photographing and I'm poking around, this person, this patient, had been an ice barrel jumping champion at grocery stores. You don't know that until you're in the home. You wouldn't know that in the hospital. So it just gives you such a better ability to work with people. These are just a few slides from home health aid and homemaker training program that we have put together. Now, in conjunction with CHHA, right, comprehensive employment training, right, people were on welfare, waiting, right? People that were interested in becoming home health aides that were on came, they got paid for the training, right? And at the end, they got paid for the training, paid for the time. At the end, they were home health aid homemakers. They were able to work in nursing homes, hospital, home care. This is, just some of that same program, and this is part of the, one of the graduations that we had. A lot of people, all of these people came off of the welfare roles into viable jobs that were necessary in the community. And one of the things that they could do, so now we have physical therapy and speech therapy, and the home health aide could follow through with the program. The nurse would have to supervise every 2 weeks, but the home health aide could follow it out. Right. So, Gladys and my passion too is always, in terms of prenatal care, right? So, we set up the setup was that a hospital would do the deliveries. A hospital would do the lab testing. Dr. Randy Cohen and Lou Brzezowski were private OBs that contracted with us. They did all the deliveries. They did all the clinic work. You can see, we had people were laying on tables, right, with these curtains with safety pins on it. It was amazing. It went on to then become, once this building got built, a real prenatal clinic. We had 3 exam rooms, we had 3, it was amazing. The prenatal clinic had 150 women in it, and marvelous outcomes, all high risk, all fabulous outcomes. And what I did was this mom was also on WIC and also got home visits, so it was a real three-pronged look at her and her family. So child abuse. So one of the things that public health always has to look at is what are the needs. So child abuse, you see it. I mean, you just see it. And it was so prevalent and so strong. So one of the things that Gladys did was we had a conference, and this is Victor Fontana, who wrote the book The Cry of the Child, and Dr. Lou Rodriguez, right? And we also then, in addition to that, formed a child abuse task force, went out and spoke to people about child abuse, were mandated reporters, had a Good Parents Anonymous set up in the community. And I'm not sure when I was, probably sometime in the 90s, we were in this building already, and there was a child, Christopher Gardner. Everybody remember that case, right? This is a little 2 to 3 year old boy that was, malnourished, starving, and sort of beaten to death by his caregivers for going for candy, right? So Denise Franch-Canning, worked here at the time, and what we did was started this column in the newspaper called Christopher's Corner, and tried to write about it. But you see it in all. This is Gladys, Jim Galligan, right in the middle there, Dick Bailing. This is one of the health fairs that we had down at the thing. We would have health fairs and go to the Office of Aging and Cooperative Extension, talk about nutrition, and take blood pressures and all kinds of stuff. There's Georgia also. So this is the public health. So one of the things that public health does, right, is infection, disease and infection. You are the people that are monitoring for this. So right around 1981, when nobody else was really paying attention, right, AIDS hit, right? AIDS hit New York, but AIDS really hit. Sullivan County was like the third highest, right, for AIDS in the state of New York. Now, why was that? One, because I was testing. Nobody was testing. If you wanted an HIV test, you couldn't get it here. The doctors weren't doing it. The hospitals weren't doing it. We were doing it. We, public health nurses, absolutely discovered all the pediatric AIDS in the county, right? And here's just like a fun sort of case for you. So we had a little boy, he was like failure to thrive, lymphadenopathy, told the doctor sent him to Westchester County for 2 weeks, sent him back, didn't do any testing, came back and stuff. We tested him, HIV positive, right, he's like 4 years old at this point. Okay, so now what do? Now you want to test the mother and the father, and the mother's pregnant, right? She's HIV positive, and the father's HIV negative. Right, and the tricky thing was that and only Westchester County was treating anybody with HIV. So, and boy had to go down one day with social service transportation, right? But mother had to go another day. They couldn't accommodate them both on the same day. But anyway, the thing for public health that you've got to watch out for is that drug resistance is almost going to be universal. There are some people that I believe, people have read Lauren Garrett and Coming Pledge and different things. There's some predictions that by 2030 there will be no treatable diseases with antibiotics. So you've got to be really careful. And when you see, sometimes too, like these, I had a hip replacement last year. So anyway, I got a hip replacement. The doctor, I'm out of the bed in 15 minutes, okay, get up, walk. I'm like, the sheets aren't even wrinkled, right? So, he's like, okay. Right, so now he's like, okay, here's your meds, go home, go pick up your pharmacy, right? One bottle, 42 tablets, Oxycontin, right? No pain. I brought it back to the doctor, gave him a little talking to. I said, if you do 100 surgeries a month, you're putting 4,200 tablets of Oxycontin on the screen. But, and he's a great doctor, Track is a fabulous doctor. But the other part of it is that, so now, generically, people are like, well, if you've had a hip replacement, you have this. If you have, when you have your teeth cleaned, they want you to take antibiotics for 2 days. I'm like, no way. You should not ever. So, oh, that's what I said. So anyway, I got the orthopedic surgery, like, guidelines, from the internet. And it's like, no, only the most severely compromised patients. So, because the dentist was that, okay, I could have antibiotics for 2 days. I'm like, I had to get the surgeon to write it off the doctor. But anyway, infectious diseases, right? You guys are really so rabies is one of the ones, right? So remember I was telling you we had 15 supervisors. So one of the supervisors was this guy, Rick Lander, right? And Rick Lander owned a campground along the river in 97. And I don't remember the year, but it was July 4th, and at his campground, all those people, we had a rabid fox, right, that we called Rick Lander. Right? So from this, right, rabies, we had cats and dogs clinics that people are going, now to. The other thing is that, I guess it was in the 90s, I'm not really sure. We got a call, we got a call from Westchester County Medical Center. They want to let us know that an 11-year-old girl has got encephalitis and has died, right, in Westchester County. And she's calling in Carol Ryan, people know Carol Ryan, she was a public health nurse at the time. And as they're describing Carol Ryan, is just like, no, that sounds like rabies. That sounds like there's a stiff neck and all. That sounds like rabies, right? And Carol got the Westchester County medical people. The only way you can tell rabies is through slides of the spinal column. They had to go into the spine and see the bodies in the spine. This girl had died of rabies, 11 years old. She had gone to, never figured out whether her rabbit had died at home, and then she went to camp up in the Adirondacks, and she got sick. From there, they transferred her to the medical center. She died. We never found it, but again, public health. It was a real loss, and because of that, that's everything. So because of that, laws in New York changed about these camps. You can't just have bats like lurking up in these camps when people are there. The other time that Sullivan County was responsible for change in law was after the Woodstock Festival, right? Actually, the Woodstock Festival in Sullivan County, there are now laws for mass gathering, and you have to have water, and you have to have food. Woo! That was dental care, right? So I had done this slide that says glass that had some dental care. Dental care was very important to me. It has been a major part of what I've done in my life. But this was, nobody was linking oral health and regular health. And we were seeing like all kinds of kids with dental disease. They couldn't go to school. They had all kinds of swelling. People didn't know Streptococcus mutans, the bacteria that makes cavities, also affect your heart. So it's great. I see dental care is now pretty much everywhere. The Prasad Project, really, which was, when the Prasad Project was formed, they came to me as the public health director, and they said, we'd like to do something for Sullivan County. What do you think is needed? I said, dental care for children. So I know you've got dental care around. It's a school-based program. It's a mobile clinic. I would highly recommend that you get some flyers here and they know about it. Okay, we just show this room next to this. This is the whole step of public health. I mean, it's just how you guys have grown, and it's amazing, right? Then, and so part of what's really great about today is celebrating. So at some point, these guys are Polish, so whatever, we had some Polish like celebration, right? Where, whatever, me, Gladys, and Nancy Palski. And I don't know how you are here, but one of our staff people had a baby that she needed to bring to work for a couple of days. So we did. Yes, she was. So how to accommodate your family. So this girl is, she's probably like 48 years old. So the nurses had cars. Every nurse had a car, right? So what was what was different was that people would call up and say, Mr. Smith just got discharged from the hospital. I mean, this is his address. The nurse would go, right? You go there, you take care of it. You didn't have to call the insurance first and find out. And when the nurse got to the house, and the nurse, made the plan of care for how many times the nurse visited, the PT visited, wrote the orders, and the doctor said, good, So back then, it's a lot different. But hey, we're always, we're just joking about the cars, the problem with the cars. The car, it was great, but there were problems. The first car I drove, right, I was new to Sullivan County. I worked at Mount Sinai, and I didn't know the county at all. I didn't know Spring Glen from Glen Spey. You know how far apart they are? And the car that I had no radio, and it had a shift up on the driver's column. I could shift it like that. And there were no cell phones. There was no GPS, right? It was and I loved it. I still love it, right? So it's the people who think like, oh God, this is you're home is frustrated. This was the intake office, right? These are the records, right? We had paper records, right? So I did a lot of first visits, right? Once I got there, right, and there were no street signs, and I lived up in North Brent, so the area I did a lot was Asphodel, Long Eddy, on the back roads into Roscoe, and then you have to write the directions on there so the next person can get there. But anyway, it was always frustrating. So if you're frustrated, hang in there. This is Bobby Stewart. She was just great. The thing that you don't see here too, we didn't catch it in the other. She would have an ashtray piled high. Right? Gladys was smoking, right? Everybody was smoking like crazy. And when I was the public health director, one of the things I had to do was make the county go tobacco free. It was crazy here, but trying to get the hospital to go tobacco free was a nightmare. Right? But it happens, right? This, I just want to say, Lila Milstein was a school nurse that worked in Fallsburg. I guess school would get out at 3 o'clock. From 3 to 5 during the year, she would visit a patient. Right? But in the summer, when the school closed, she went around to all the bungalow colonies, and what she did was check the immunizations of the kids. People were supposed to be immunized, so that was me. And that was so the state health department, right, was always a partner in terms of they could regulate, but our part of the regulation for the bungalow colonies was seeing that the kids would be immunized. So the inner eye, you gotta really, I'm very prejudiced. I love the job. I hope you love the job. If you don't love the job, get another job. Because you are the only people going in these homes that say public health. No matter what I was doing or how it was going on, when that nurse or that home health aide hit that home, that's who public health is to them. So I say, love this job because, one of the in-services that we had gone at one point, that somebody's saying, there's two kinds of people that do home care. Those that don't need supervision and those that don't want it. And I was like, and that's true. That is true. That is true. You cannot, you have to trust that the people that you're working with, that are going out there, are doing what they say that they're doing, because you don't know, right? And you don't know. You don't know. And, this is my older son, who turned out to be a tattooist, every mother's dream, right? This sketch that he did when he was like maybe 10 or 11. But I love this. I mean, for me, it's always like when you think you're stuck, you know, when you think you're like really trapped, figure it out, like really look at it. You know, sometimes we set up these simple mazes for ourselves that are, you know, never trust a smiling cat. This was here. You've got to be kind to each other. I've been very concerned. You know, every now and then I run across people that, you know, have worked here, retired. I'm like, what's going on in public health? Somebody said, like, snakes. Snakes. That broke my heart. That just broke my heart. So I think it's wonderful what you're doing in terms of team. You've got to trust each other. And the other thing that I would say is that I would always tell staff, like when you're out there and you're visiting people and you get together for lunch or something, don't unload on everybody. Don't bitch about it. You know, talk about something fun and what you're doing. Or, you know, you've got to really try, because you're out there by yourself. You're so much, right? When you're doing this. Yeah, I don't know. This is like, just want to be there. This is so wrong. Right? This is so wrong, right? And it's so right. It's so wrong, and it is so right. Gladys so Dick Baling was a supervisor for the town of Tustin, right? And they just did this, I'm sure, for the picture, you know, for me. They ran out taking a picture. However, what is so right about it is the feeling of the public health person and the board of supervisors and the legislature. Somehow you need to do that, whether you invite them on home visits with you, whatever you do, but this feeling is really important, and it's so important that they believe so much. This board of supervisors believed so much in public health and in the health of Sullivan County. They built the adult care center. They built the shared clinic facility, right? Because they believed in it. And Sunset Pond, and the pursuit of truth will set you free even if you never catch up with it. So thank you for letting me speak today, and I hope you all love the job as much as I did, and Sullivan County is lucky to have you.